friends, welcome to Dr.Bone YouTube channel. Today we are going to talk about the topic thyroid hormones and its effect on bones. Hello friends, today we are going to discuss about the topic thyroid hormones and its effect on bones. So first of all we will see our higher center hypothalamus. Hypothalamus secretes thyrotropin releasing hormone which acts on anterior part of the pituitary gland and secretes TSH, and TSH acts on thyroid glands, and thyroid produces T3 and T4, whereas T3 are active form and T4 are higher in number. So friends, now we are going to see how this thyroid hormones acts on our human body. So first thing, we have two conditions. Whenever this T3 and T4 levels are low in our body, we call that condition as hypothyroid. And whenever we have these T3 and T4 levels at a higher proportion, then we call that condition as hyperthyroid. Now, what are the causes for causing hypothyroid and for causing hyperthyroid? We have an autoimmune condition which we call it as Hashimoto thyroiditis. And second one is whenever we have low levels of iodine, then also it causes hypothyroidism. And third one is whenever we have some pituitary or hypothalamus dysfunction. And there are others also. And when we come to hyperthyroid, we have Graves' disease, and we also have whenever we have iodine in excess, that also causes hypothyroid. And we also have toxic multinodular goiter in this condition. And we will see what are the symptoms in hypothyroid and hyperthyroid. So this thyroid hormone basically it increases the metabolic function in the human body. So whenever there is low levels of thyroid hormones and we have less heartbeat, that we call as bradycardia. And whenever we have higher levels of heartbeat, then we call that condition as tachycardia. And in hypothyroid condition, we have cold intolerance because our metabolic rate is low, and that causes the cold intolerance. And when we come to hyperthyroid, we have heat intolerance. And when we come to hypothyroid, it also acts on the GIT for the motility and for secretion. When we have less levels of thyroid, that decreases the GIT motility and secretions, which obviously causes constipation. And whenever we have high levels of thyroid hormones, okay, that causes more motility and more secretions in the gastrointestinal system, that causes diarrhea. And the thyroid hormones also help in maintaining our mental balance. Okay, whenever we have less levels of thyroid hormones, that causes depression, and when we have higher levels, that causes anxiety and even nervousness. And thyroid hormone also helps in maintaining a proper skin, and it also helps in maintaining the sweat glands in a proper way. And whenever we have less uh, thyroid hormone, that is in a hypothyroid condition, that causes thickening of the hair, which we call it as coarse hair. And whenever we have that function in hyperthyroidism, okay, that causes silky hair or even hair loss. And as there is less metabolic rate, then we gain the weight in hypothyroid condition, whereas in hyperthyroid we'll have weight loss. And even in hyperthyroidism we also see exophthalmos, that is the eyeball protrudes out, that we can also see in hyperthyroidism. Now let us see how this thyroid affects on our human bones. Okay, so in a normal, that is in without any thyroid disease, okay, So here is our bone, and you already know that we have two types of ossifications in our body. First one is membranous ossification, and second one is our endochondral ossification. So this thyroid has a direct effect on endochondral ossification. And what is this endochondral ossification? So when we are at a young child, okay, at that particular time, all our long bones, first of all, they form cartilaginous, and then it converts into as a normal bone. So we call that change from cartilage to bone, that type of ossification, we call it as endochondral ossification. And it also helps in maintaining the interstitial growth. What is this interstitial growth? So here we have the growth plate, and it helps in the length, in the growth of this interstitial, this growth plate. Okay, and thyroid has a direct effect on bone remodeling. How this bone remodeling occurs? First of all, we have osteoclasts, and then we also have osteoblasts. So it maintains that proper balance that helps in bone remodeling. And you already know that in 1 year there is almost like 10% bone remodeling occurs in everyone. So whenever we have hypothyroid condition, how it affects in children. So in children, when automatically when there is no interstitial growth, then it affects the growth of that child. And whenever we have hypothyroid condition in children, it also affects the endochondral ossification. Okay, so and it also, this hypothyroid, in hypothyroid condition, it also lowers down the bone remodeling, which is that it also reduces the osteoclast activity, and it also affects the osteoblast activity. Now we will see how the we'll see the condition in hyperthyroidism. Okay, so in hyperthyroid condition, what will happen? We'll have direct effect on bone remodeling. So it increases the bone remodeling. Suppose in an adult, that bone remodeling should happen in a normal process, that is osteoclast followed by osteoblastic activity. Now when it keeps on increasing this remodeling, then it can lead to osteoporosis. I hope that should be helpful. So in hypothyroid condition, what it happens? It affects the growth of the children, and when you give the medications, then they can cope up with their growth, and it also affects in bone remodeling in adults and even in children. So and in hyperthyroid condition, how it affects? It affects in bone remodeling. So it can also lead to osteoporosis in few patients, and it might or might not affect on the density of the bone. I hope that should be useful. Thank you.